Hello my dear friends, welcome to the Soundara Nursing channel. So in this video we are going to study about planning. So in the previous video we are already studied about nursing assessment and diagnosis also. So planning is the third step of the nursing process. So in this video we are study about planning, introduction, definitions and purposes and more. So let's study about what is meaning of planning and definitions and all, and why it's important to study to us, and what are the purposes. So let's begin. Planning is the important third step of nursing process. Planning is the third important step of nursing process. It is the determination of what is to be done, when is to be done, where is to be done, and who will do, and also how to evaluate the results. So planning is the determination of what is to be done. So what is to be done and when is to be done. When we are going to explain about the any disease condition, means we should know about the what is the exact cause of that disease and what is the condition, right? So in the planning also, not only just like giving the care or reduce the disease condition. Planning is that in the planning we are giving the care also, as well as the you are educate to the patient, right? So planning is not only like that, okay, patient is having some problems and we are just cure to the patient through the planning. That is right, step by step we are step by steps we are giving the some care so that patient will be cured. Not like that. Planning is nothing but not only giving the some care and all. Planning is that if the patient is not having much of the knowledge about the disease, means we should be educate about the that disease condition. So that is also come under the planning only, right? So what is the main thing is here, means what is to be done. If the patient having some problems, means what should be done and when it should be done, and also where is to be done. The place also be very important, right? Where is to be done and who will do, and also how to evaluate the results. This is very important. Who will be do and where to be done, right? So the according to the procedure we should be select the place, right? So where should be done and who will be done. So that is, and how to evaluate the results. This is a important of the planning point, right? What is be done and when to be done and where, and also who is able to do. So that's also be very important in the planning. Next, definition of the planning. So according to the Quasar in the 1975, what they are told means planning is the deliberative systematic phase of the nursing process that involves decisions making and the problem solving. So planning is a nothing but it is a systematic phase of nursing process that involve the decision making, the problem that making and decision making and problem solving. So in a simple word, planning is nothing but it is a problem solving and making the some decisions is called as a planning according to the Quasar. Then next we are going to study about purpose of planning. So what are the purpose of planning? First is give direction to the client care activities. First purpose is that give the direction, right? Give the direction to the client care activities. Second is establish continuity of care. Establish or enhance the continuity of care. Then third is focus on proper documentation. The third purpose of planning is that whatever the documentation is there, so that is focus on the proper documentation. Then fourth is encourage the delegation of care activities of the patients. Next, types of planning. So in the types of planning there are mainly three types is there. First is initial planning, second is ongoing planning, and third is discharge planning. In the planning, there are mainly three types of planning is there: initial, ongoing, and discharge. So what is the meaning of initial planning? Okay, so first point is initial planning, right? So what is the meaning of initial planning? Means the planning done immediately after the initial assessment is the initial planning. So initial planning is nothing but immediate caregiver after a initial assessment. Means when the patient is entered to the hospital, means when the patient is admit in the hospital, means we should be give the immediate care to the patient. So that is the initial planning. Initial in the sense that is a primary planning we called as the initial planning. Initial is nothing but a immediate care, immediately care given after the initial assessment is the initial planning. Then second point in the initial planning, that is planning must be started early because of the trend towards shortage hospital stay. Planning must be started early because of the trend towards, right? Initial planning means that is a primary, means that is a shorter stay hospital. In the plan, in the initial, in the primarily, the patient will be stay in a very shorter time. So we should be start very early and immediately. That is because of the trend toward the shorter hospital stay. Second type of planning, that is ongoing planning. In the types of planning, second types is ongoing planning. So what is the meaning of ongoing planning? Means it's done by all nurses who give care to the client. Ongoing is nothing but processing, means continuing. Ongoing means continue, continuation. It's done by all nurses who give care to the clients. They carry out delay planning by using ongoing assessment. Is called as a ongoing planning. Next point is discharge planning. Discharge planning is nothing but it is the process of planning about the needs which will occur after the discharge of client. Discharge planning is nothing but it is the process of planning about the needs which is will occur after the discharge of the client. So what the patient needs after the client, means after the discharge, so that is a discharge planning. After the discharge, whatever the patient is needed, we should be educate about that. We should be educate about that the disease condition, as well as after the discharge, what should be give to the patients, means what should be patient can be take. So regarding that, that is a discharge planning, is the process of planning about the needs which is will occur after the discharge of client. After the discharge of client, what should the client will be need, means we should be educate about the disease and what should be take. So that is a discharge planning. After the discharging from the hospital, what should the patient should be followed regarding that. Then phases of planning. So in the phase of planning, there are mainly four phases is there, four phases. That is, first is setting priorities, second is determining the goals or expected outcomes, and third phase is selecting the nursing strategies, and fourth is developing nursing care plan. So these all are the phases of nursing planning. So if you want explanation about the phases of nursing, means please text in the comments box. Thank you for watching.